want to talk about a topic that's maybe a little bit controversial, and will get more controversial as the percutaneous space becomes more opened up to people that are not typically and traditionally trained in performing open surgery. So there's advantages and disadvantages to everything. I want to make the distinction. Open surgery is a lot of devascularization, devitalization of soft tissues. You can transition from open to MIS, minimally invasive surgery, that is mainly poke holes using neurologic monitoring, indirect decompression. But then the next transition beyond MIS is percutaneous. So I'd like to make that distinction, and we'd like to look at this this continuous, and the continuum of this is probably best illustrated by SI joint fusion. So SI joint fusion